Hello and welcome to this HCPLive RX Review Special Report. My name is Shahriari. I'm an Associate Clinical Professor of Dermatology at Yale University and the Associate Director of Clinical Trials at CCD Research. In today's discussion, which is centered around scalp psoriasis, we'll be breaking down the latest updates and most pressing unmet needs in the management of plaque psoriasis, in particular in the scalp. I'm joined by Biologic Coordinator David Hartigan of the Biologic Coordinators of Dermatology. Thank you for joining me today for this discussion. Why don't you introduce yourself to our audience?
Thank you so much. My name is David Hartigan. I am a biologic coordinator for the Biologic Coordinators of Dermatology. I have been doing this for just over 8 years and have seen a vast growth of things. And I am excited to have this dialogue and discussion with you.
Well, I'm so excited to have you here because I know the access piece when it comes to medication is always a challenge for me. So I'm going to be picking your brain, I'm sure. But just to kind of start us off, from your perspective, what kind of patient concerns, whether we're talking cosmetic, practical, adherence related, come up most often with scalp or topical treatments? And what do you think of roflumilast and its ability to address those?
Great question. A lot of the patient concerns with topicals are, is it going to cover the surface area that they're covering, depending on the vehicle type. And in this case, there's two different vehicles. We have a lotion cream, um, and we have a foam, and both cover the body surface area differently. Um, and that's the biggest thing with the patients is, is it going to work? Number one, because chances are they've already tried other things and, we're going through the steps and they finally get to this point and they're like, I don't know. They have questions, they're concerned. And I completely understand their concern. Plaque psoriasis isn't the greatest thing to deal with. So we try to get in their shoes and, comfort them and let them know that, we're here, we're trying, and that there are different medications out there, such as, the Zorive, and that they're in different vehicles.
I couldn't agree with you more. And I think sometimes as a clinician, I'm very limited in terms of the time I have with my patients. So you might see a lot more of those patient concerns and considerations that I may not see. So it's great that you can convey that to your clinicians.
Absolutely.